My name is Angela. I live in Colorado, and I manage my primary immune deficiency with Hizentra. Born and raised in Colorado, so I was always very active outdoors, skiing, biking, hiking, you name it, all the Colorado things. There was always sort of this process of strange infections, unusual symptoms throughout my life that no one could easily understand the cause. By the time I got diagnosed, like many patients with primary immune deficiency, I would imagine, I was at the end of my rope. I had a moment where my immunologist said, you look pretty good, but how are you really doing? And that one question changed everything for me. I was able to open up and explain that I was hanging by a thread. So thankfully, my physician was willing to do the research to present all of the treatment options to me. He also worked really hard to understand my life and what treatment was going to make the most sense for me so that I could get the treatment to live my life and not get a treatment that I had to build my life around. When I was presented with my options, subcutaneous immunoglobulin therapy with Hizentra really made a lot of sense for my lifestyle. Particularly, I was a young professional traveling all over for business and was very concerned about what the impact to my professional life and my personal life might be. So I loved the idea of being autonomous in my treatment. In particular, using the pre-filled syringes is helpful. In my case, I have some limited strength and mobility in my hands, and so the pre-filled syringes make the infusion process even more simple and straightforward and more streamlined. I think as a patient, it's really important to advocate for what's important to you. And it takes some courage sometimes to speak up and really be clear in what's important to you, what's important in your life, what your needs are. It's a skill that all of us need as patients to really make those shared decisions with our physicians. One of the most important ways you can do that is by documenting your symptoms, your questions, anything that you want to discuss with your physician. Come to your appointments prepared and ready to communicate the details. I actually use the Hizentra app to help me keep track of all those details, all the information that's going to be pertinent, and to help me identify trends in my health over time. I also worked really closely with my specialty pharmacy, which was really important to really optimize my treatment. It was really important that I expressed my fears and concerns to my doctor, to CSL, and to my specialty pharmacy so that I could really get all of my concerns addressed and feel comfortable moving forward. Through the Hizentra Connect program, there are numerous resources that are extremely helpful that I recommend every patient consider enrolling in those from the very beginning because you never know what you're going to need down the road. And I have found every bit of them very helpful throughout my journey. So I really did lean on the educational resources, training videos, training materials. Speaking with another patient who was actually on Hizentra was extremely important in that it reassured me on the safety of the plasma product, the efficacy, and also that it would fit into my life rather than me rearranging my life around the treatment. I did also enroll in the Hizentra copay program. At first, I didn't know if that's something I would need or qualify for, but I'm so glad that I did because it did turn out that I actually did qualify, and it's been very helpful to have that copay assistance. Hizentra has been life-altering in the best way possible for me. When I think about my life now, there's life before Hizentra and life after. And I would choose life after Hizentra hands down every time. It has enabled me to continue doing all the things that I love, to be engaged with my loved ones, to continue my career, and to really live my best life.
Important safety information. Warning. Thrombosis, blood clots, can occur with immune globulin products, including Hizentra. Risk factors can include advanced age, prolonged immobilization, a history of blood clotting or hyperviscosity, blood thickness, use of estrogens, installed vascular catheters, and cardiovascular risk factors. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Treatment with Hizentra might not be possible if your doctor determines you have hyperprolinemia, too much proline in the blood, or are IgA deficient with antibodies to IgA and a history of hypersensitivity. Tell your doctor if you have previously had a severe allergic reaction, including anaphylaxis, to the administration of human immune globulin. Tell your doctor right away, or go to the emergency room if you have hives, trouble breathing, wheezing, dizziness, or fainting. These could be signs of a bad allergic reaction. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Inform your physician if you are pregnant or nursing or plan to become pregnant. Infuse Hizentra under your skin only. Do not inject into a blood vessel. Self-administer Hizentra only after having been taught to do so by your doctor or other healthcare professional and having received dosing instructions for treating your condition. Immediately report to your physician any of the following symptoms, which could be signs of serious adverse reactions to Hizentra: reduced urination, sudden weight gain, or swelling in your legs, possible signs of a kidney problem, pain and/or swelling or discoloration of an arm or leg, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, unexplained rapid pulse, or numbness or weakness on one side of the body, possible signs of a blood clot, bad headache with nausea, vomiting, stiff neck, fever, and sensitivity to light, possible signs of meningitis, brown or red urine, rapid heart rate, yellowing of the skin or eyes, chest pains or breathing trouble, fever over 100 degrees Fahrenheit, possible symptoms of other conditions that require prompt treatment. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. Please see full prescribing information for Hizentra, including boxed warning and the patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.